Good morning. Thank you so much for being here today. We are here today for some exciting announcements for new legislation, but before we get into that, I want to note that we are joined today by the speakers who you'll be hearing from soon to my right. Megan Stanley, Deputy Director of the City of Pittsburgh's Commission on Human Relations. Anupama Jan, Executive Director of the City of Pittsburgh's Gender Equity Commission. Dr. Chelsea Palantino, Postdoctoral Research Associate at McGee Women's Research Institute and the University of Pittsburgh School of Medicine's Department of Obstetrics, Gynecology, and Reproductive Sciences. And Dr. Kathy Elliott, Executive Director of WENS Girls. And we're expecting some members of the City Council Women's Caucus to be joining us hopefully soon, as well as members of the Mayor's Office who are invited as well. So we are here today to announce the introduction of legislation to safeguard employment protections for pregnant employees and their partners, and to announce a new guidance document to help employers take steps to prevent discrimination in their workplace and employees to know what to do in the case of possible discrimination. This legislation expands and clarifies exactly the type of employment discrimination that is not allowed when it comes to pregnant workers anywhere in Pittsburgh. The legislation also protects the partners from employment-based discrimination so they can emotionally and physically support their pregnant partners, becoming one of the few cities in this nationwide to protect partners in this way. We're also very excited to partner with Pittsburgh's Commission on Human Relations, which is releasing an accompanying guidance document that you should all have that lists best practices for creating pregnancy discrimination policies. It provides examples of reasonable accommodations, and it outlines the responsibilities of the employers of pregnant workers. So why is this legislation needed? In 2014, then Councilman Dan Gilman ushered through legislation, which was co-sponsored by other members of council, that added pregnancy as part of sex-based discrimination, which was a major step forward in Pittsburgh. Since then, in looking at other cities and other states, we've realized that by defining pregnancy, childbirth, and related medical conditions and events as its own category, it would be even more explicit and expansive in our definition, and that would therefore help pregnant workers to more fully understand their rights and employers to better understand their responsibilities. For instance, related medical conditions and events can occur before, during, and after gestation and after childbirth. This legislation explicitly protects against employment discrimination during each of these phases, and as mentioned, also protects partners of someone in any of these phases. So why else is this needed? According to the U.S. Equal Employment Opportunity Commission, pregnancy-based discrimination claims have been skyrocketing for nearly 20 years nationwide and are at an all-time high right now. Last year alone, the agency received nearly 3,200 claims, which is double the rate in 1992, when electronic records were first kept. This is also an equity issue. The U.S. Census Bureau determined that within married couples that include a man and a woman, 2 years prior to their first child, a man made only slightly more than his wife, but after the first child is born, a woman can make as much as $25,000 less than her husband. And what's more, in Allegheny County, 72% of families living below the poverty line are headed by single mothers, and 64% of single mothers are in the workforce. So this is an economic equity issue, this is a social justice issue, and this is a family health issue as well. No person, but especially not a head of household, should have to choose between having a healthy pregnancy and providing for their families. And while pregnancy discrimination affects individuals of all races, it disproportionately affects women of color. While Black women represent 14.3% of the labor force, they filed 28% of pregnancy discrimination charges nationwide. Even though pregnancy discrimination has been technically illegal nationwide since 1978, we know it's still rampant across all industries in the United States, and there are loopholes in the federal law. Legislation introduced each year in Congress can't even get a hearing. That's why states and cities like Pittsburgh are picking up the slack. So the legislation being introduced today ensures that pregnant workers whether they work in a corporate office, a retail store, or a warehouse, can work in a safe and comfortable environment, attend medical appointments, and sustain a healthy pregnancy without fear of losing their job or benefits. No one should have to endure the experiences of Atisha Woolbright, who, when she got pregnant, was asked her employer, Walmart, to stop lifting heavy trays and was told by her boss that being pregnant was no excuse. So she kept lifting until she got hurt. Or Rachel Mountis, who was winning awards for being a top salesperson at Merck, only to be laid off 3 weeks before giving birth. Or Erin Murphy, who after returning from maternity leave was told to pump milk in a supply closet cluttered with recycle bins. So we're calling on employers in Pittsburgh, all throughout the city of Pittsburgh, to review the guidance document that we're releasing today, adopt strong policies around pregnancy, and to help prevent pregnancy-based discrimination from ever occurring in the first place. And if you're someone who believes that you've been discriminated against because of pregnancy, even if you're not sure you want to file a claim, I urge you to reach out to the Commission on Human Relations by phone, email, or by visiting the 9th floor of the City County building here to help get answers and file a claim if appropriate. If you work outside of the city of Pittsburgh, you can file a claim with the State Commission on Human Relations. So with that, I am pleased to introduce Megan Stanley, Deputy Director of the Commission on Human Relations for the City of Pittsburgh, who will speak about the process and what this means for Pittsburgh. Thank you.
Thank you all for coming today. I just want to speak briefly today about the need for the proposed legislation in regards to combating pregnancy discrimination in the city of Pittsburgh. The Commission on Human Relations investigates complaints of discrimination in housing, employment, and public accommodations within the city of Pittsburgh. We also conduct outreach and education events for employers, landlords, providers, and residents. With almost 4 million births in the U.S. last year, pregnancy is an incredibly common condition, yet one we have not given adequate attention and protections to in our current civil rights law. Currently, pregnancy discrimination cases are filed on the basis of sex, excluding protections to partners and leading to confusion on the part of pregnant employees. The case of the Pennington estate is a tragic example of this. In this case, a Mississippi man committed suicide after he was fired for taking a day off to accompany his wife, who had been diagnosed with a high-risk pregnancy, to a pregnancy-related appointment. His estate sued, alleging that he was discriminated against based on his sex and his wife's pregnancy. With this proposed legislation, Pittsburgh has the chance to be a leader in the nation by providing broad-based protections for pregnant employees and their partners. While a select number of jurisdictions across the country cover parenthood or family responsibilities, this legislation recognizes that pregnancy and related medical conditions or events are not limited to a 9-month period. We seek to offer protections before, during, and after the gestation period for pregnant employees and their partners. The Commission on Human Relations has also created a guidance document, which you've heard about, for employers to help them better understand their responsibilities and how to best serve these individuals. We also offer free training and welcome questions of those seeking to better understand how they can create a more equitable workplace in Pittsburgh. Thank you.
Thank you, Megan. And before I introduce our next speaker, I do want to note that we've been joined by Chief of Staff Dan Gilman, who did get this ball rolling. I have to mention again, did get this ball rolling back in 2014 with his legislation initially adding pregnancy as part of the definition of discrimination against someone based on sex. So that was really the beginning of all of this, and now we're fortunate to be in a position to be able to add on top of that. So next, I'd like to introduce Executive Director of the city's Gender Equity Commission, Anupama Jan, who will speak about how the legislation advances the mission and the goals of the Gender Equity Commission.
Thank you.
Hello. The Gender Equity Commission is the city's newest commission. We've been meeting for just 1 year. We're very excited to support legislation like this. We know that people in the city are really committed to gender equity, but our policies don't always provide the protections we need. And this means for people of all genders, but also to address historical discrimination against women. Women are more than half the population. They have not been reflected and continue not to be reflected in our workforce in the ways that we expect, and some of these are because of barriers like our policies that don't explicitly reflect the realities of most Pittsburghers' lives. I think that we are very lucky in the Gender Equity Commission that City Council is such a good partner to us. City Council member Deb Gross serves as a commissioner, and certainly Council member Strassburger has really helped us to support policies that are going to make actual change in our city. And what is really important about this, it's not merely about seeing discrimination as punishing, it's seeing our ability to be proactive, that we're going to be working with the city, with the Department of Human Resources and Civil Services to ensure that discrimination is addressed, but we are also asking everyone in the public and nonprofit and private sectors to join us. These are good for all of our workplaces. This kind of policy is a win-win. So I'm really excited to be here and that you'll be hearing from some of our commissioners about how much this matters to all of us in the city. Thank you.
Thanks, Anu. And I do want to mention, just piggybacking off of what Anu just mentioned, this doesn't have to be all punitive. We've found that in places like California, which do have policies in place like this statewide, that discrimination claims have actually decreased, and it's actually one of the few regulations that employers say, that welcome and say, this is good that we have these regulations in place. It's forced us to have policies, and it's allowed for claims to decrease. So this is something that we hope all employers can take proactively. Next, I'm pleased to introduce Dr. Kathy Elliott, Executive Director of Gwen's Girls and Gender Equity Commissioner, who will speak on how the legislation will help to address inequity in the city.
Good morning. As stated, my name is Kathy Elliott. I am the Executive Director of Gwen's Girls, a nonprofit, community-based organization that provides services to young women and girls. I also am a member of the Gender Equity Commission here for the City of Pittsburgh. On behalf of both of these entities, I'd like to express support as well as gratitude for Councilwoman Strassburger for introducing this legislation. I also want to reflect and to add a few words as a single mother of two. As Anu mentioned, that this legislation isn't just words that are on a paper, but it's the reality of many of us living here in the city of Pittsburgh and across the nation. My youngest son celebrated his 26th birthday yesterday, and over the past few days, I've been reminiscing about my pregnancy, and even more so when I learned about this legislation. See, when I had my son, I also had an 18-month-old daughter. Like many single mothers, I worked and attended school up until my due date with both of my children. For many reasons, I felt I had to. I felt I didn't have a choice. I did make the choice to have my babies, and I am fortunate that I had the opportunity to continue to work and felt supported and continue my classes to pursue my career as a registered nurse. As this legislation indicates, historically, pregnancy is among the most common reason that many female employees are discharged or subjected to a reduction in their work hours or loss of health insurance, with such discrimination disproportionately impacting females of color. According to the Pittsburgh Foundation's recent quality study of single women, 64% of single mothers in Allegheny County are participating in the labor force, compared to 70% of two-parent households in which both parents are employed. This legislation will provide the protection and outlines the supports that pregnant employees and their partners need. One of my loved ones recently gave birth to a beautiful, healthy baby girl. 6 months into her pregnancy, she was diagnosed with gestational diabetes. This required her to go to her obstetrician every 2 weeks. She had been on her job only for 1 year, or less than a year, and she didn't receive the interactive process that's outlined in the Human Relations Commission's suggestions for us to follow. She felt unsupported by her employer and ended up quitting. With limited income, her car was repossessed, which is a hardship, and she and her 3 children endure daily. This is the reality that we are talking about that happens all too often. Her baby just turned 4 months old, and she recently secured employment. However, it's like she has to start all over again. The resources and the supports that she had prior to becoming pregnant were not there. If she would have been able to have that secure employment throughout her pregnancy, her situation may have been different. This legislation, with the guidance of the Human Relations Commission, will educate employers and employees that it's not just an opportunity, it's a legal right to choose to have a baby and to work and to live. I would like to thank Councilwoman Strassburger for the work and commitment she has put into introducing this, and thanks for the opportunity for me to speak to you today.
Thank you, Kathy. And finally, I'd like to introduce Dr. Chelsea Palantino, postdoctoral research associate at McGee Women's Research Institute, who will speak on a medical perspective and how the legislation will help pregnant individuals sustain a healthy pregnancy without affecting their financial well-being.
Good morning. My name is Chelsea Palantino, and in addition to my position as Councilperson Strassburger said at McGee Women's Research Institute, I'm delighted to serve on the City of Pittsburgh's Gender Equity Commission along with Dr. Elliott and Executive Director Jan. City of Pittsburgh Councilperson Strassburger's legislation and the Commission on Human Relations establishment of protected status to pregnant persons from experiencing pregnant-related discrimination in the workplace will build on the guiding tenets of the Convention for the Elimination of All Forms of Discrimination Against Women, or CEDAW, the foundation of the CEDAW ordinance, which created the City of Pittsburgh's Gender Equity Commission. CEDAW supports the creation of protections that prevent imposition of any sanctions or dismissal on the grounds of pregnancy status, and states that pregnant persons should be guaranteed appropriate services to support their needs throughout the pre- and postnatal period. Ending all forms of discrimination against women and ensuring the equitable protection and provision of services and opportunities to enhance women's participation in public life, in the workspace, as well as their quality of life, also supports Goal 5 of the United Nations Sustainable Development Goals, which is to also achieve gender equity and empower all women and girls the world over. This legislation, as has been mentioned, builds on the Pregnancy Discrimination Act of the U.S. Equal Employment Opportunity Commission and Pennsylvania's Human Rights Act, which collectively ensure an equal protection to pregnant persons regarding their working conditions, employment opportunities, right to pregnancy-related leave, and health insurance and temporary disability-related benefits. As has already been said, the EEOC and other entities have found an increase in pregnancy-related discrimination, with the EEOC finding between the years of 1997 to 2011 a 50% increase in pregnancy-related discrimination charges. And according to the National Partnership for Women and Families, over 30,000 charges were made between the years of 2010 to 2015 in the U.S. regarding pregnancy-related discrimination. However, as we know with many social and health outcomes, that this number is drastically underreported. And this number underrepresents the true prevalence of pregnancy-related discrimination being experienced by pregnant persons in our country, as it is estimated that 250,000 pregnant employees are denied pregnancy-related accommodations each year. This varies from firing to being denied rightful raises or promotions in the workplace. As Dr. Elliott said, African American women and women in low-paying jobs are experiencing this inequity at disproportionately higher rates. And this disparity is compounded by the fact that we know very well that women of color experience higher rates of adverse maternal and child health outcomes, including miscarriage, low birth rate, preterm birth, and infant mortality, among other negative physical and mental health outcomes for the pregnant woman, her infant, and her family. This year, the Pennsylvania Department of Health projects there's going to be over 13,000 births in Allegheny County alone. And by building on this legislation with the City of Pittsburgh's new pregnancy-related discrimination policies, pregnant persons and their families and their partners will be given the protections and accommodations needed to attend necessary visits and accept appropriate care. It will also address unfair treatment and build on these existing laws by preventing pregnancy-related discrimination and strengthening the protections on pregnancy-related discrimination to ensure equitable services. Through this legislation, the city will strengthen and promote accountability among city employers to give pregnant persons and their families the necessary medical care and supportive services they need to ensure a safe and supportive transition to parenthood so that they may continue to fully participate in the workforce and in their family life throughout the pre- and postnatal period without repercussions. Thank you.
Thank you, Chelsea. So that concludes our formal remarks.